Hi everyone, David Moricca here, founder and CEO of Socialive. Excited to be coming to you live from New York City today. And today's topic is going to be how to build an effective content strategy for the pharma industry. I have a wonderful guest. It's Emily Krassen here of Pfizer. And Emily is the Senior Manager of Video Strategy and Content. She's a member of the corporate affairs team, and she's been a Socialive customer, so we've had a great opportunity to work with her over the last couple of years. And she is really on the front end of video, social, live, has great gems to share with everyone today. And we're really going to talk about how her team has been leveraging video and live video in an industry that's regulated, has some unique needs, and I'm excited to kind of have her share some of her thoughts today. A bit about Pfizer. I think you probably have heard of the organization, but it's one of the world's largest pharma companies, as you know. It's a Fortune 100 company with revenue north of 50 billion. Just have a new CEO, so a lot of kind of corporate change within the organization. And it's a real pioneer, I'd say, when it comes to the front end of technology. Certainly in the digital and social space, I'd say it's certainly been a pioneer and really kind of embracing emerging technology. And as I mentioned, has been a Socialive customer for the past couple of years. So Emily, to start, I'd love for you to introduce yourself and tell us a little bit about your background.
Yeah, of course. And thank you so much for having me. I'm excited to be here talking about video, which I love. My name's Emily Krassen. As David mentioned, Senior Manager at Pfizer, Video Strategy and Content. So responsible for video that goes out on our corporate social platforms, all above brand content. Okay. So this isn't any products, any ads, any DTC, just generic above brand content. A lot of times our content does play to disease state awareness, but again, no products are ever mentioned, so I can talk about that later on. My background is I used to work at YouLive, which was a digital video startup within Scripps Networks Interactive. Right. Food Network channel, HGTV travel channel, so in the lifestyle space, which is now a part of Discovery, but I was on the digital video team there, and I went to school for television, radio, and film communications at Newhouse at Syracuse, but that's kind of shifted from linear to digital in my work.
Yeah, so deep background in the video space, great. Why don't we start by talking about some of the unique challenges and imperatives that you have in your role, being specifically within the pharma industry. Like what's different about corporate affairs and corporate marketing in the pharma industry vis-a-vis, say, Scripps or some other organizations?
Yeah, it's very different because for Scripps, it's really easy, or for lifestyle companies or news channels or certain outlets, it's really easy to create fun lifestyle content and videos that feature recipes and DIY homes and things like that. Yep. It's a little harder to tell the pharma story, and what is the pharma story. Something that's exciting about my team is a lot of folks actually aren't from the pharma industry, so we try to come into it with a new light, but also taking advantage of resourcing of folks who are have more of a deep-rooted in pharma intel. So some challenges that we face, of course, are really humanizing ourselves. I'm learning that too as I go on, on video shoots, as I'm learning more about the organization, the stories behind the scientists, stories behind the manufacturing, the stories behind colleague resource groups, and a lot of our diversity and inclusion efforts that we have going on. So kind of being able to take a peek behind the curtain and see what really the real Pfizer is, besides what some people try to define us by.
Yeah, and why? Yeah, and to take that a step further, why are those stories important to tell when it comes to Pfizer?
Yeah, so I think those stories are really important to tell because a lot goes into a medicine being made. A lot goes into being a really large company that has a big footprint in our society and at large. So I think that's really important to see all of the effort, all of the work, the tireless hours that scientists are putting in, or QA is putting in at manufacturing, to know it's not just an easy thing. There's a lot of work, there's a lot of brain power, there's a lot of dedication, people dedicating their lives to breaking through changes to help patients' lives.
Yeah. It's really interesting. Kind of take something that historically has been faceless and kind of put a real human face on it, so you can have more connection to the brand and to what's being, the medicine that's actually being created.
Exactly.
Save lives. Okay. What strategies and channels has the pharma industry, and Pfizer in particular, generally relied on prior to, say, the social revolution?
Yeah, I think that previously a lot that was relied on, and this kind of goes into kind of just the evolution of media at large. So it used to be being in trade publications, magazines, or it used to be featured in physical newspaper articles, or maybe a website or something like that. With the evolution of media and just the ramp up of social media, that's obviously shifted. All of these outlets, these news outlets, now have a digital component. There's now a lot more opportunity to join in the conversation and not just and have it be a two-way street rather than one. There's still, of course, importance of those traditional outlets, but now a lot of it's digital and a lot of it is on our owned and operated properties. So just to go on based off of that, we have channels on all the main social media platforms, so Facebook, Twitter, Instagram, LinkedIn, YouTube, and Pfizer.com. That's what the team that I sit on, works on the content for that. But what we've really kind of doubled down on recently is LinkedIn, and is Instagram.
So yeah, tell me a little bit, why have you seen a shift from, say, the more traditional linear channels, if you will, or print channels, to this kind of digital and social channels?
So I think it's just the general trend in how people are consuming content. I mean, the biggest content device is that, even smaller, it's your iPhone, and you're using that, whether that's on your commute, whether that's on your day-to-day downtime. That's what people are doing in their downtime instead. Kind of the mobile video revolution, as you, I think, have spoken about it before. But you want to get in the apps, you want to get in the feeds, in the news of where people are. People aren't going to you, you kind of need to go to the people.
Yeah, that's interesting. I totally agree. And so you've been an early adopter of social, but also live video. And our collaboration really began around Facebook Live, and then has moved into LinkedIn Live. Can you tell us a little bit about your, what was the decision-making process that brought you guys as a team, brought your team to think about live video and ultimately go after both with Facebook and now with LinkedIn?
Yeah, I think with Facebook Live, you have the opportunity to engage with your audience, and you have the opportunity, again, for it to be someone sitting in on a conversation, or someone being able to maybe not attend a conference or attend something, an initiative that an executive's passionate about, but really like sit in and watch at the table. And the great thing about Live is people can interact, so we're able to gauge feedback. It also can range in length. So, whether it's 10 minutes or 5 or 15, you can have that conversation in whatever time you need, where as a stagnant video or non-live video, you're just telling the story. And with live, you're able to kind of take a seat at that table, if you will. I think that our big transition from Facebook to LinkedIn is kind of a trend for LinkedIn also. So I was just talking about this earlier with some other folks. LinkedIn used to be, 2-3 years ago, where you'd go if you were looking for another job or networking other job opportunities, seeing what was in the water. Now it's really a content platform. I have the app, I go on it to read articles and look at content and figure out interesting things that are going on. So I think now that it's become more of a content platform rather than a job seekers platform, that just plays really well. Also for us to kind of shift and doing more LinkedIn Lives now that we have the ability to, rather than Facebook Lives, or at least doing dual streaming. LinkedIn is our most active channel, especially in terms of followers. So we have 2.6 million followers on LinkedIn. We have over 300,000 on Facebook, which are both great, but millions versus thousands, obviously a big difference. So we're able to reach more folks doing LinkedIn Lives.
Great. What have you seen to be the great advantages of live video from an audience perspective and for your storytelling perspective vis-a-vis kind of more traditional video?
Yeah, I think that live video, kind of like I mentioned before, people want to get to know, the humans behind Pfizer, the executives at Pfizer. We have a terrific amount of, and actually for the industry and like Fortune 500 industry at large, we have a lot of female executives, which is something I personally like to look to. And I think being able to sit in on that and see who they are and what their passions are, rather than just them being like a talking head in a video, when you're seeing them answering questions that maybe came in from the live or that were crafted around specific things that we're trying to address. I think that that's like a really good opportunity and something that we want people to feel like we're approachable, we're human, and we have things that we'd like to share, and we want to share with you as you're sharing with us.
You guys, recently, your team did a simulcasted live to not only the Pfizer LinkedIn page, but also to Sally Sussman's page, I think the Chief Corporate Affairs Officer?
Yes, correct.
Yeah, which I thought was really exciting. Talk a little bit about the thinking behind that move.
So Sally's great, and Sally loves writing. She has a very active LinkedIn presence where she's sharing articles of wisdom or advice or short posts. She does a lot of content on her LinkedIn. She's grown her follower base. So people are really interested in her as well as Pfizer. But then we kind of cross-pollinate the audiences when you're doing a simulcast. So the fact that we were able to reach people who follow Sally and they get the notification that Sally Sussman's now live and know to tune in or to check it out later once their meeting ends or wherever they may be during the day. And then also the ability for people who follow Pfizer who actually might not know Sally as much as Sally's personal followers to see what she's all about. That was a great opportunity for us to leverage using both platforms.
Do you find that bringing in thought leaders at the organization like Sally and like Dr. Frida Hall,
Yep.
Chief Patient Officer of Pfizer,
Yes.
I believe, do bringing those folks in help humanize the organization to followers?
I think so, and I think that that's really what we're trying to do. A lot of those broadcasts have been with other Pfizer people in it, but I think people are more looking to them as the leaders, as professionals who've kind of grown in this space and advanced through their careers to two very important roles we have at Pfizer, to learn from them. And it's not always about something that's specific to Pfizer or the industry. I mean, I know that Sally's live was specifically actually talking to the interns and talking to Gen Z and learning about what they're looking for in a role in purpose-driven work. So it's not just always talking about Pfizer. Sometimes it's talking about things that are happening at large, and we just want to be able to showcase that.
Great. Are there any risks or drawbacks to live video or social video more broadly?
Yeah, and I mean, there certainly are. We're in a regulated industry, which we know, which is why we have monitoring in place for reporting AEs. That's a part of our corporate policy, but we have that in play for all of our content, for all of our social channels, to just make sure that the I's are dotted and T's are crossed. I mean, I think the other kind of risk that is run would be having negative comments or haters, trolls, whatever that might be. We found actually that's what's really great about LinkedIn is LinkedIn isn't faceless. LinkedIn, there's a human, there's their job, there's their network. It's your professional setting. So we found that people are actually way more positive than any other platform on LinkedIn, which really makes sense when you think about it.
Cool. So let's move back a couple years. When you first started bringing up the idea of live video on social channels, it's pretty innovative stuff for a pharma company. Talk to me about how you sold that internally, how you got buy-in.
Yeah, so it's great, and it's a partnership, and it's constantly evolving as platforms evolve as well. I think what's important to keep in mind is, like I mentioned at the top of the broadcast, all of our content isn't about any product. It's all above brand, whether it's about health facts or employee engagement or things that we're doing, kind of out in the world, out in the field with D&I initiatives. So that makes it a little easier from a regulation perspective, knowing that there won't be any product mentions. Also, a lot of times if we have, some sort of a script, that will obviously be run by legal in advance. If we have kind of like the log line of what we're talking about, that will be run by legal in advance to make sure that there aren't any red flags or anything like that. I mean, live is live and you're live. However, there's always the delete button. Luckily, we haven't had to do that, but if we had to remove content for a reason or another, yes, a lot of resourcing goes into, and time and effort goes into creating a live video, but we of course always want to be compliant, so if we would have to delete something, worst case scenario, we could, but we try to, gain comfortability and make sure everyone's aware that, everything's being monitored and that we won't talk about any brands or any claims or anything like that. So that also helps us with our storytelling.
Got it. And with the risk and compliance teams and the legal side, how do you work with them at a strategic level and then on a per broadcast or content piece level?
Yeah, so it's kind of like dominoes a little bit.
Okay.
In that a lot of times all the teams are kind of siloed in a way, but a lot of times if there is one team that has buy-in and that has done it, and it's been executed successfully, with no red flags, then the next team feels comfortable doing it. So then it kind of just ends up growing the comfort level. So while, at a senior level, high level, people are aware of this happening, we have all these use cases built out. And because also we had use cases built out for Facebook Live, that made LinkedIn Live a no-brainer because we're saying it's, essentially the same thing, just a different platform. So that made it kind of an easier win going from Facebook Live to LinkedIn Live.
Makes sense. How has Socialive helped you eliminate or mitigate some of the risks associated with live video?
Yeah, so with Socialive, there's a lot of levels of control and levers that we can pull to try to make sure everything is compliant and the ease of use is there. In another vein, in terms of optimizing Socialive, a lot of the things that make capturing live video stressful, like video assets for lower thirds, graphic templates, things like that, we can bake those in ahead of time in advance of the live, and that makes it really easy to create a broadcast that's more polished, even though it isn't a full production. So there's a lot of features that are great for us. Another thing I'd say with you guys being a startup is just the ability to implement and ideate really quickly. So in the field, at conferences, wherever we are capturing this content really around the world, sometimes we hit snags. And knowing that, okay, I had this pain point, is there something we could do to kind of overcome this in the future? And then having a tech tweak or an advancement, enhancement, 2-3 weeks later is awesome, incorporating like real-time feedback.
All right, so let's talk about creating a video content strategy and a live video strategy. What has been the kind of content that you've mostly focused on from a live perspective? What's really worked for you?
Yeah, so from a live perspective, would definitely be kind of what I mentioned before, being able to kind of see beyond, behind the curtain, peek behind the curtain, and featuring a lot of our executives. So some have been tack-ons to existing things. So whether it's something like the Atlantic Festival or something like Aspen Ideas Festival, where there's a ton of exciting energy and topics being discussed in the health space, in the leader space, in the business space, and someone can't attend, you can sit in and hear the learnings from there. So it's like you're virtually attending, which has been successful and great. Another thing is featuring content that might not be like super Pfizer specific in nature, and might be more about things as Sally Sussman, our Chief Corporate Affairs Officer, did a LinkedIn Live with 3 interns. That was a lot of it was about like the 2 generations working together, Gen Z, a purpose-driven culture, what folks are looking to get out of rewarding and fulfilling work. So I think the more broad we can be in some sense to reach that audience on LinkedIn Live is great. We're also constantly iterating. So the team is like somewhat new, and we're constantly changing. We have the best resource. I'll probably bring her up a lot on this discussion, but we have an in-house analyst. So if any team can try to get that as freelance work, I highly advise investing in that, because we use analytics-driven content strategy. So we'll see something is doing well, okay, so this did well, how can we duplicate it, or what are some insights that we can use? So we initially have, metrics from Sally's LinkedIn Live, from Dr. Frida Lewis Hall's LinkedIn Live, knowing that they outperformed a ton of content. How can we create more live content, because this clearly is resonating?
Yeah, that's interesting. So what are the key metrics that you tend to look at to determine how your content's performing?
Yeah, so it depends based on live versus not. We have internal benchmarks. And what we're looking at least for lives right now, are our video views, our impressions, our things like engagement rate, and then also now we have the ability to look at reactions when you're doing Facebook Live and LinkedIn Live, which reactions, of course, don't play on regular social feeds, just on lives. So that's another kind of metric we have baked in a little bit too.
Okay, well, we'll come back to that in a little bit later, but going back to your content strategy, so what other content are you planning to innovate or try over the next 12 months?
Yeah, so we're doing a lot with live. We're also doing a lot with Instagram. Okay. That's kind of like our most precious channel. But we've been doing a lot, and my colleague Erica also has been doing a lot with our Instagram stories. So we've been having best practices. We've been trying out all of the features, which is something you don't necessarily think a pharma company would do. But I think a lot of times when we play more in the fun lifestyle space, especially on that audience, because we know that what the demographics are, we know they're younger, we know it's a very global audience, those tend to do really well. So whether it's answering a poll, whether it's doing a quiz, Instagram's constantly coming out with new features, which we love, that we're kind of doubling down on as well. I think I mentioned this at the top of the broadcast, but I'd say LinkedIn and LinkedIn Live and Instagram are the two platforms that we're working with the most, which when I started at Pfizer around 3 years ago, wasn't the case. So I think those are the two we're most excited about. Also, I know that Instagram Live is a thing. We have tested a little bit. I think they're still figuring out how to get users on the platform, because Insta Stories, I think, clearly blew Snapchat out of the water. But IG Live hasn't really taken off in the same way. So I think once it gets mass traction, we'll look to invest in it more. But now that it doesn't have the same user base, and we don't also have the same numbers in terms of followers on Instagram Live as LinkedIn Live, or as on LinkedIn in general, I think we'll pivot and invest in that once it starts getting more traction on its own from the masses.
Yep. Talk a little bit also with live video. One thing that you've been doing quite nicely is simulcasting. So multiple profile pages and corporate pages, as well as multiple channels. Talk a little bit about that strategy and how that's worked for you.
Yeah, so it's really easy. So I think that's the best thing. It's almost like, why not? Why not get that additional audience? Why not get that additional viewership? There is content, obviously, that plays better on each channel. But if you can get the Facebook audience as well as the LinkedIn audience, and then we'll see really where it plays. But you can aggregate all those video views, you can aggregate all those impressions. So it's kind of like the more the merrier. Why not simulcast as many places as you can, which makes sense.
So we're broadcasting here on LinkedIn Live, and you at Pfizer have been one of the early adopters of LinkedIn Live. I think you might be the first pharma company to go live on LinkedIn, and there's only probably a few hundred companies in total that have gone live on LinkedIn. Has this strategy paid off, getting early on LinkedIn?
It's absolutely paid off. So we're lucky to be being a part of LinkedIn Live and being able to broadcast on our corporate channels. We know in due time that access will probably be granted to a lot of other folks. So we want to be able to test. We want to be able to get our messaging out. We want to do kind of as many lives as possible while we have this momentum and while we're featured in this light of being, I think, the only pharma who's doing LinkedIn Lives. But yeah, we're super excited about it. I mean, I mentioned this before. I think LinkedIn is like the next main content platform hub, even more so, I think, than Facebook. It might shift in time with a lot of issues Facebook's been having. So we're just excited we can leverage our audience for LinkedIn Lives, and yeah, our 2.6 million followers and growing. It's crazy. I think it's also because we're a big employer and because we have a lot of employees and people interested in what we're doing in this space. But we love being able to get our audience, our message out to a broad audience.
That's interesting. So LinkedIn Live not only enables you to reach, new followers of the company, people are interested in the company, but do you find your actual internal employees engage well there?
Oh, absolutely, absolutely. Okay. So I'm not a part of the internal comms team, but of course we have counterparts and we have colleagues that we work with. So a lot of times that link will be shared around, whether it's with internal chat, internal email, other platforms that we have to share our news internally. That link, whether live and actually live or after it's been broadcast, gets shared around, and we see a lot of engagement there. Being a global company, a lot of things that we do, a lot of times unintentionally, are more US focused. Events that we go to with executives or the time things are broadcast and things of that nature. But with something like LinkedIn Live that stays up and archived, or it's streaming live so you can watch it in the comfort of your home, you don't have to be in the office for it. I think it's really great for our global colleagues because they can also kind of sit in and see everything that's going on.
Yeah, well, I think if I remember correctly, you guys are going to be doing some content from Tanzania, highlighting some of the work you do in Tanzania. Is that right? Can you talk a little bit about that?
Yeah, so we're in partnership with the nonprofit FHI 360, and we have a global health fellows program also at Pfizer. So in Tanzania, we'll be able to highlight the partnership that's going on, being able to see really what's going on in the field, which is super awesome to see from your office in New York in your cube, being able to tune in to Tanzania and see what's going on there. So it's awesome that Socialive has the ability for us to not be stationary, and we really can be anywhere in the world.
Awesome. So you don't need to get into specific details, but how is the viewership and engagement metrics of your live videos on LinkedIn compared to some of the metrics of your regular posts? Yeah,
so like I mentioned, we have that analyst. So she actually sent out to everyone just a little recap of how Sally's LinkedIn Live performed. And it prompted folks to say, oh yes, this is great, we need to double down on this. I mean, the video views for Frida's, for Nanette's, for Sally's, for a lot of the folks that we featured have blown the video views out of the water for other content. So we're definitely incorporating it into our strategy, into communications plans, wherever we see fit and wherever we think that there's an exciting angle. We never want to do a live just to check a box or for the sake of doing a live. We want a message that will resonate with some of our audience, all of our audience. And we don't want to certainly do it just to do it, but everything has indicated through our KPIs and overperforming and benchmarks maybe having to be readjusted or recreated based on lives that it's been fantastic for us.
Right. So let's move to another topic area, which is efficiency of video creation. Look, you got a lot on your plate, your colleagues have a lot on your plate. How do you historically, what have been the challenges you've seen in video content creation at the organizations you've been at?
Yeah, so we're really trying to democratize the video production process, kind of teach the teacher, give best practices, give tools for success. I think what's great about Socialive is you can be logged in at different places. We're constantly really busy, so a lot of times we're covering for people when people are on certain video shoots or work travel or personal travel or whatever it may be. And the ability to go into the platform and access things is really great remotely, and I think it's just another use case of ease of use.
Yeah, and I'd love to kind of ask, people might assume when they hear from you that Pfizer must be a massive team working on this stuff. How big is your team, and how many people are working on each live and video content piece you do?
So it's a really small team. So actually, part of the reason why my new role came to be is because video is so big on social, whether it's live or otherwise, and it's a more resource-heavy kind of process, especially not with live video, but when other videos were being created, whether it's figuring out production schedules or getting cuts of notes or things that take a little longer and are more labor intensive. We actually do not have a large team. We're not, a marketing team or anything like that. I'm the only person solely devoted to video. We have other folks on the content team, 2 people, and then 2 other people are like half-time, and then also doing other work. So it's really not a large team. What we were saying before about kind of teaching the teacher is we've been trying to also like empower folks, whether it's in other communications functions internally or other types of communications, empower them to be able to do lives as well. We also have counterparts. We have an in-house studio, which we're really lucky to have, which they've traditionally done like internal videos, leader videos, things like that. They're now an incredible partner in getting us set up with equipment or having us be able to shoot lives in the studio. And Jeff, who's the studio director, and I like work on a lot of projects now together. So it's really just armoring everybody to feel comfortable with lives, so we can get mass production, because we can't be 2 places at once.
Yep.
Yeah.
And so as someone who's kind of a pioneer in the pharma space on this front, what strategies or tips or insights would you provide to, say, other folks in the pharma industry or other regulated industries who want to kind of take advantage of what you've done?
Yeah, I'd say don't be afraid to be bold, or just because something's never been done before that you can't do it, or just because you think a story needs to be told one way, you can't shift it. And like I said before, kind of the use cases and with getting sign off and things like that, once people are comfortable and once people see and you prove out one use case of something being successful, it's a lot easier to get buy-in at all levels, whether it's senior leadership or whether it's legal, to create more of that. So I'd say that, and I'd also say don't be afraid to think out of the box and do things on the fly, and don't be afraid. I know this is a common thing, but don't be afraid to fail. I think everyone's a worrywart and scared of failure sometimes, but I think the only way, and because you have analytics so easily, being able to pull it from a platform, if you don't have an analyst, you can see what's doing well and what's not. So if something's not doing well, a series isn't doing well, you can dump it and move on to the next.
Right. Yeah, that's a really good point, right? Like, we need to recognize that content's always moving.
Yeah.
Nothing, things are ephemeral to some extent, and you got to kind of try things. You got to innovate.
Exactly. And I'd also say just knowing that investing in video is kind of the way of the future right now. So if you don't do it now, you're going to be forced to do it later and play catch up.
That's such a great point. So any other like best practices that you would recommend to folks who are starting to build out their video content strategy and even their live video strategy?
Yeah, I mean, a few things. I'd say having whatever way, shape it takes form, having an editorial calendar, everyone should know, is the way to go, especially if you're dealing with a lot of teams. So with lives, coming up, we have a lot scheduled. Everyone's being kind of stretch thin, going different places, doing lives. We'd never want to put out something like 2 lives in a day. We don't want to cannibalize our audience. We don't want to oversaturate the market. There's a lot of reasons for that. So knowing when things are planned, same thing with Instagram stories as well. You don't want one story to be back to back and bleed into the next. So making sure that you're planning things out carefully. And if something doesn't have to be posted or streamed on a certain day, having flexibility to fill in the gaps, that's like a huge tip, I'd say. Also kind of knowing that a lot of times your phone's the best friend, your best friend in capturing content, in getting live photos, tidbits, things on the fly. Sometimes you can do everything in the palm of your hand.
Great. So, looking forward, let's kind of bring it back to some concluding points here. So what are the challenges that you see will continue to exist in the pharma industry to fully kind of embrace social, mobile, and live?
Yeah, I mean, I think a lot of the challenges are our perception. So I think until we can have our colleagues tell the stories, we want to be the ones telling the stories. We don't need people who don't work with us or for us, outside looking and telling those stories for us. I also think that legal, just the more you can empower and educate legal, and then other ambassadors of your company are great. So we've done a lot of LinkedIn trainings, workshops, just teaching about the platform, not live specifically, but teaching about how many users are on it and what it's being used for and the evolution of certain social channels. I think the more you can educate, the more you can empower, and the more you can get buy-in. And I'd say another thing to kind of think about in the evolving industry is just, it's only gonna increase, you know, video, social platforms, and people's attention spans are also going down too. So you want to do as much as you can well, but also you don't want to oversaturate, like I said, or ever, you know, stretch yourself too thin that you're doing something just to do it. Make sure that you have strategy behind that.
Yeah, and I think you gave a nod to this already, but what are some trends you expect to see in the pharma space when it comes to communications?
Yeah, I mean, I think, and we've seen this too, like a lot of pharma that weren't on certain platforms are now active on certain platforms. I think a lot of pharma now is unafraid to talk about other things and weigh in on awareness days or celebratory months that maybe they didn't in the past, but that we should play a role in. So, for example, Pride Month is something that we didn't really have much of a presence, and then we had somewhat of a presence when I started, and then we saw that it was resonating well, so we amped that up the second year and then continued to grow. So I think don't be afraid to get in on the conversation at large rather than just being, you know, siloed or bucketed into pharma. Another thing is just our science is just so incredible, so amazing. Anytime I meet our scientists, whether it's up in Cambridge, in Massachusetts, or La Jolla in San Diego, you know, those are the real heroes. We're just here to help tell their story. So really making it, you know, giving them the outlets to tell that story, and you can see their passion, using that to kind of fuel your storytelling.
I love it. And what trends, or how do you think video will evolve in the next 5 years in the pharma comm space?
Yeah, so not even pharma, but at large, I read a lot of stats and reports on how video is going to increase by like exponentially even in the next few years. I think it's just going to be more and more. So whether that's more and more lives are playing in, whether it's short video, vignettes and things like that on your social feeds. Video is just overtaking things. It performs better than a stagnant photo, and we found that that's a lot of the case, whether it's with us or in other industry. I think this is like just the beginning, to be honest. And of course, there's always the fear of like consumption overload, and you can only handle so much. But the first 3 apps I think that most millennials open are Facebook, I want to say Facebook, Instagram, and Snapchat. And I think that in all sectors and all demographics, there's 2 or 3 that everyone open first. And I think LinkedIn is going to be one of them.
You're going long on LinkedIn.
Tripling down.
I'm with you. I'm going long on LinkedIn too. I have been for a while. Are there additional applications for video content across the pharma organization from what you've seen? So beyond kind of social and external corporate communications, where else do you see video starting to take off within the enterprise?
Oh, absolutely. So what's great is being able to capitalize on shoots or things that we're doing for social or external content, but being able to build relationships throughout the organization to have multiple use cases. So content can live many lives, which I always like doing. So for example, we'll be doing a video shoot in La Jolla with some scientists. Can we also interview the scientists for short clips? Can we also do a LinkedIn Live while we're out there? Can we also potentially convert those videos into videos that can be used at scientific meetings or at internal meetings and town halls? You know, there's no reason to reinvent the wheel, and good content is good content. You know, content's always king. So I think being able to have an asset that everyone can access and use in multiple cases, it also helps save resourcing, it helps save time, and I think that that's the wave of the future, is not just double duty assets, but like triple, quadruple duty assets.
I love it. This is something we're talking about so much with our customers, so I'm glad to hear our work with, you're kind of like one of the leaders in that, which is, every video piece you have is something that you should repurpose and kind of continue to leverage, cut down into different units, right? Yeah. That piece is got a life that's well beyond that moment in time or that one distribution channel,
exactly,
right?
Yeah. Repurposing and cut downs are two of my favorite words. I use them all the time in my day-to-day. But yeah, also thinking about, okay, we launched this video. There's no reason sometimes that the following year it can't be used for something else. Or you can't tie it into a STEM holiday or a Girls Who Code event. There's so many use cases, and the more also you can make the content evergreen, I'd say, that's a tip too. So you can play around with it so that it fits naturally into other events.
Well, we're about to sign off here, so any final points you want to make for folks who are listening in?
Final thoughts, okay. Pressure is on. So I'd say, don't think that that video is just a blip or just a trend. I think it's here for the long haul, and I think the more you can get ahead and start investing in video, and also especially if you're at a large corporation, empowering and enlisting like senior leadership to see the power of video, the earlier on you can do that, the better, because they're the best messengers a lot of times for the message, and they're also the best folks who can help empower the teams to see the value as well.
I did say that was the last point, but you raised such a good one that I need to follow up on it, which is enlisting senior leadership for them to see the power, the value. I think that's a really good point. How do you do that?
So for enlisting senior leadership, I think the best way to do that is sharing all of the information, the good, the bad, the ugly, but it's actually been good so far. So sharing whether it's a live or whether it's a video they're featured in that we ran across our social channels, seeing the engagement, letting them see how many views they got, letting them see how many people they reached, I think that's really impactful. Because they can see their message getting out, they can see that everything was kind of worth maybe the prep or the timing or whatever it may be, and they can really see the impact that they're having and how many folks they're reaching. And I think sharing those insights, those analytics, help play a role in making them, advocates.
Love it. Well, I want to thank my guest again today, Emily Krassen.
Thank you for having me.
You've been fantastic.
Thanks.
Emily, again, is the Senior Manager of Video Strategy and Content at Pfizer. She's a member of the Corporate Affairs team, and she really is on the front end of all things social, all things video, and all things live video. Thankfully for us, she's also a Socialive customer,
yes.
and been great to work with. But for those of you who got a chance to hear her, scrub back, listen to some of these great insights. Emily really has a lot of experience on how to innovate in an industry that's regulated. There's complexities that are different than maybe other industries, but Pfizer continues to push the envelope with great success. So I want to thank you again for being here, and for those of you who had a chance to attend, I'm David Moricca again, founder and CEO of Socialive. Really enjoyed this conversation today and hope to see you on the next one. Thanks.